Hello everyone. Today's aspect we know that health is wealth. But which one, physical or mental? Well, both. If we consider about that, in the physical we do exercise, we do morning walks, joggings, and many more things to achieve our physical wealth. But what about the mental wealth? During the COVID-19 or after the as like COVID-19 completed, we know that it has all been decreasing. So from that aspect, the government of India launched a TeleManas program on 10 October 2022, which is launched by Mr. Nityanand Rai, the Minister of State for Home Affairs. Where right now it has a help whose number is 180089144416 or even short dial 14416, which is available in more than 18 languages, which provide you a telephone based counseling. And even the government has also launched the TeleManas app related to the video consultation if you need that. So what is about TeleManas? Well, it is about telephone based counseling where you get your help related to the anxiety, depression, stress, emotional disturbances, work pressure, financial responsibility, family responsibility, health issues, addictions, exam stress, and concerns about relationship and many more which you need to in your life. How does you get to your solution? Well, Telemanas has four levels: base level, mentoring institutes, regional hubs, and apex. First is base level, which there are 53 cells present in India, where there are trained counselors which provide you 24 times 7 support which is done by a specialized psychiatrist, clinical psychologist, and physiatric nurses, which provides you the counseling related to your mental health which you and those issues which you needed. Then there is mentoring institutes, which there are 23 centers in India which provide you backup support when you need an expertise if you don't get resolved at the base level. Then there is a regional hubs. There are 5 zones in India which provided coordinated escalation support. And then there is a main apex, a main body which is NIMHANS, which is National Institute of Mental Health and Neurosciences, which provide training, data governance, and quality control to all these aspects. So as we know that according to the Mental Health Care Act of 2017 enshrine access to mental health as a statutory right in India, still over more than 11 crore people in India still suffer from mental health issues. I have to go with that because it has already received more than 3.1 million calls since it has been launched. It means we can say that exact number or approximately 31 lakh 80,000 and 743 plus calls they have already been received, which means more than 2600 calls per day. Every day they received a call related to the mental health issues since they launched October 2022. You should have to go because they Telemanas does not record your calls. Your calls are not audio recorded. Your phone number is marked whenever you call to the Telemanas. Your phone number is marked where Telemanas give you a phone number as a unique Telemanas ID, which is seen by a counselor who will support to you related to your issue. And there are counselors even backend teams don't see your numbers unless it is legally authorized by any higher authorities. And you should not have to reveal your full name, your gender, your location, or any personal identifier, full information about all these things, so you can fully talk and get to the specialized care about the issue. What do they actually? In the first few minutes, they conduct the counseling where they make a risk assessment about your current situation of what you are saying, what you are facing right now, which means they make a risk assessment and they define that whether your life is in risky right now or not. If they think that they are risky, they call a tap. Then they activate district level emergency link where you are living, which connect with the local DM, HP teams, police, or even medical officers. So how does you connect to that? Take your phone, open to the dial pad, type 180089144416. You will make a call, then there is an auto dialing. I don't know what the technical term is all about, where they said tap press 1 for this, press 2 for this, and all this. First they will ask about languages, then they will ask about states. It means you live in, then they will ask about states. one for this, two for this, three for this. Actually, you should not have to listen 29 states and 7 union territories, all these things. No, you have a network. They have a network aspect. So where they are receiving your calls from internet towers, the state you are living, and your neighboring states. So press one for this state, press two for this state, and press three for this state. Mostly the you should have to just press one from the state you belong. It's the most of the time. You just have to click and directly only these two steps and your phone directly transferred to the counselor. And there is other levels which we have already discussed. So what do you think if we go over the statistics? And that statistics surprised us that over the last 3 years of calls since it's launched October 2022, male female ratio is 45 is to 52, which is unusual in the mental health industry, that male call as much as female calls related to the mental health issues, which is too unusual. We can say that too much unusual in mental health service industry. So you can call and get to that because many of the millions of people have already called and get to their support. Hope you understand what is about TeleManas and why, and there is a way where you can get your mental health back and achieve as a wealth of your mental health. We can say that if we consider health as a wealth, you have already achieved your physical, but about mental, then to achieve your mental health as you should have to go with the telemanas, or even you can talk with your friends, go traveling, stay in a silence every day for a while, just silence to run your thoughts and all other things. But at the end, you need a someone at the third person perspective who don't even know you and understand your current situation about the issues which you are facing right now related to the mental health. You should have to go with that, Talimanas. Yeah, I prefer to go with you. I prefer to go with that. At least a try. Who knows? Can be a good thing for you and your mental health. Hope you understand. Thank you.